Bismillahirrahmanirrahim. Today we will discuss benign prostatic hypertrophy or benign prostatic hyperplasia. The hypertrophy and hyperplasia are interchangeably used in this condition, and it is the non-cancerous enlargement of the prostate gland. We know that the prostate gland is an accessory uh, sixth gland and is a part of the male genital system. We know that the spermatozoa, which are produced in the seminiferous tubules of the testicular tissue, are carried through the seminiferous tubules into the rectus testis, and then they are stored in the epididymis where they undergo maturation. And the mature spermatozoa then pass from the epididymis through the ductus deferens or vas deferens, which is a long tube, and they joins the excretory duct from the seminal vesicles and to form the ejaculatory duct. The secretions from the seminal vesicles, they contain fructose, which nourishes the sperm, and mostly the secretions of the prostate that contains the enzymes like acid phosphatase, protease, and citric acid, and they make the semen is alkaline and help the spermatozoa to survive the acidic environment of the uh, female vagina. So the ejaculatory duct, which is formed by the union of the ductus deferens carrying the sperms and the seminal uh, vesicles that secrete the semen and constitute the major portion of the male semen, they join the prostatic excretory ducts and open into the prostatic portion of the urethra. We know that the urethra, when it leaves the urinary bladder carrying the urine, is surrounded and wrapped by the prostate gland, and this portion of the urethra is known as the prostatic urethra. Additionally, there is a pair of another accessory six glands known as the bulbar glands or bulbourethral glands that mostly secrete mucus. That the purpose of this mucus is the lubrication. The prostate is divided into different zones. The largest zone is the peripheral zone, which is the outermost posterior section, and it contains about the 70% of the glandular tissue. The prostate gland is mainly composed of glandular tissue, and the supporting tissue or connective tissue, which is composed of smooth muscles and fibrous tissue. The gland is surrounded by a capsule which sends out uh, connective tissue septa to divide the gland into a number of compound tubulo-alveolar glands the follicles. So the peripheral zone is the largest zone, and uh, it is the outermost posterior section of the prostate. Inner to the peripheral zone, there is the central zone, and the central zones contain 25% of the prostatic glandular tissue, and the ejaculatory duct from the seminal vesicle that carries the semen passes through the central zone. The very important zone is the most inner one, known as the transitional zone, because it contains transitional epithelial cells just like that are present in the urethra and the urinary bladder, and this portion, though it contains 5% of the glandular tissue, but it surrounds the urethra, and this portion which during benign prostatic hypertrophy compresses the urethra and cause problems in urination. The interior zone is mostly composed of the fibromuscular area. Here at this point, one thing important that I want to mention is that benign prostatic hypertrophy commonly involves the transitional zone, and which is the inner zone, just inner to the inner zone. And the carcinoma of the prostate commonly involves the peripheral zone, which is the largest outermost posterior section of the prostate. We know that the spermatozoa, they become mature in the epididymis and travel through the vas deferens, and here the ductus deferens joins the excretory duct of the seminal vesicle, which carries the semen, the major portion of the uh, male semen, and then they open into the prostatic urethra along with the prostatic excretory ducts. And we know that the bulbourethral glands, also known as the Cooper glands, they are also located on either side of the urethra, and they secrete mucus-rich fluid. So the prostatic urethra receives prostatic fluid from the prostate, which contains acid phosphatase, proteases, citric acid, and it makes the semen alkaline, and it nourishes the prostatic fluid, nourishes the uh, uh, sperms, and also protect them from the highly acidic medium in the female vagina. And during ejaculation, the semen is ejaculated through the external uh, urethral meatus in the male penis, at the tip of the male penis. Now, what is benign prostatic hypertrophy? Benign prostatic hypertrophy, we can say that it is a normal process and it is associated with aging. Though benign prostatic hypertrophy carries a slight risk of genetic mutation that may lead to carcinoma of the prostate, but this risk is comparatively later. And the hyperplastic nodules, as I said, that the inner urethral or periurethral zone, and these since this zone or transitional zone immediately wraps and surrounds the prostatic urethra, so it can cause pressure on the urethra, may cause problems in passing urine. And what happens that in benign prostatic hypertrophy, if when there is buildup of urine in the urinary bladder, it will cause hypertrophy, dilation, and thickening of the walls of the urinary bladder, and mostly the urine that stagnates and cannot be easily passed, and the bladder cannot be completely emptied, so the urine stays or stagnates in the urinary bladder, and it will invite bacterial growth and urinary tract infections. In this picture, we can see that this is the normal prostate, and here when the prostate is enlarged and has undergone hyperplasia and hypertrophy. So what happens that this hyperplasia or hypertrophy may occur in the glandular portion of the prostate, or it may occur in the fibromuscular connective tissue portion of the prostate, or it may occur in both of them. And what happens that the discrete nodules, they are found in the transitional zone, periurethral zone of the prostate. They will press the urethra and will cause difficulty in passing of the urine through the urethra. When we examine the prostate under the microscope, we see that the prostate gland is surrounded by a fibromuscular capsule that contains fibrous tissue and smooth muscles. And septa from these fibromuscular capsules run into the inside of the prostate and divide the prostate into a large number of compound tubulo-alveolar glands, are the follicles. The glands, prostatic glands, they are lined by a double layer of cells. The inner layer is the columnar epithelial cells or luminal cells that secrete into the lumen of the gland, and mostly the in prostatic hypertrophy, it sends out papillary projections. It becomes hypertrophic hypertrophic and hyperplastic. In the center of these compound tubular alveolar gland, secretions from the columnar cells may accumulate, and sometimes they become calcified, and they are known as the corpora amylaceae. So the secretions of the columnar cells in the prostate glands make the prostatic fluid, and this prostatic fluid is alkaline, and it helps and nourishes the spermatozoa to stay live in the acidic pH of the female vagina. Here we go into the pathogenesis of the benign prostatic hypertrophy. The exact cause of the benign prostatic hypertrophy, that is a disease of the aged people, mostly after age 50 and very common after age 70. So the probable pathogenesis of the benign prostatic hypertrophy is that the prostatic cells, they are under the control of testosterone or androgens that are mostly secreted by the testicular tissue, and a small amount may also be secreted by the zona reticularis of the adrenal gland. But what happens that as long as this testosterone is available, it will cause the prostate cells to live long and to continually proliferate. Additionally, there is an enzyme known as the 5-alpha reductase. This 5-alpha reductase converts the testosterone into dihydrotestosterone. And the dihydrotestosterone is a more potent androgen, and that is 10 times more efficient than simply testosterone to make growth and proliferation of the glandular cells of the prostate, particularly the columnar cells. So what happens that as the person ages, the testosterone secretion from the testicular tissue is decreased. But for unknown reasons, the activity of the enzyme 5-alpha reductase, it increases with age. And as we know that this enzyme will convert testosterone into dihydrotestosterone, which is 10 times more potent than testosterone, and it will cause hyperplasia and hypertrophy of the prostate glandular cells, and also the fibromuscular tissue. So when we take a cross section of a prostate gland, we can see that in the form of a follicle, it is surrounded by a capsule, which is a basement membrane or collagen capsule, and it contains some basal cells which are cube-like cuboidal epithelial cells, and inner to these basal cells there are luminal cells which are columnar epithelial cells, and these columnar cells secrete some substances into the lumen of the gland. Additionally, some neuroendocrine cells may also be present at the periphery in between the columnar epithelial cells and cuboidal epithelial cells. But actually, this dihydrotestosterone causes increased proliferation and growth of the glandular cells of the prostate, and that is the major cause of the benign prostatic hypertrophy. Normally, the prostatic secretions, as I said, that it nourishes the sperm, it provides citric acid, and the fructose that is present in the semen secreted by the seminal vesicles provide nutrition to the sperm, and the prostatic fluid make the semen alkaline. So the sperms, they survive longer in the acidic medium of the female vagina. So in benign prostatic hypertrophy, what happens that the hyperplastic nodules are formed mostly in the periurethral or central zone of the urethra, and it will compress the urethra and cause difficulty in passing urine. This is a microscopic uh, picture of the benign prostatic hypertrophy, and since there is no malignancy, no dysplasia, so it will appear normal. But if we compare a slide from the benign prostatic hyperplasia to a microscopic section of a normal prostate, so we can see the hyperplastic and hypertrophic cells and the increase in the fibromuscular tissue. When there is simply increase in fibromuscular tissue, the prostatic nodules are harder and more solid. But mostly hyperplasia and hypertrophy occur in the acinar cells, the columnar cells, sometimes in the basal cuboidal cells, and also in the fibromuscular tissue of the uh, prostate gland. So what will happen, that the major problem is due to obstruction to urine. When there is obstruction of to urine due to enlarged prostate, what will happen, there will be weak and inconsistent stream of urine, and this condition is called dribbling. Since the urethra is obstructed by the enlarged prostate gland, so the persons get difficulty in passing urine, and automatically this person will strain on urination to overcome the obstruction, which will cause pain during urination and sometimes trouble to start or initiate urination, and this condition is known as the hesitancy. Moreover, the buildup of urine in the urinary bladder will give the person a feeling of incomplete urinary bladder emptying, and the person will repeatedly go to the washroom, and here we say that the incomplete bladder emptying increases the frequency of urination, particularly at night, which give rise to the condition known as the nocturia. Increased urination at night time. To make diagnosis of the prostate gland, we first listen to the signs, symptoms of the patient, that how is the stream of the urine, how difficulty the person gets when he is passing urine, and then we, with the help of a finger and glove, we make the digital rectal examination, because the posterior uh, peripheral zone of the prostate is very close to the interior wall of the rectum. So if we introduce a finger into the rectum, we can feel the enlarged prostate, and particularly the if the enlargement occurs in the posterior peripheral zone, and if it is in the form of hard and solid prostatic nodules, it increases the suspicion of the carcinoma prostate. Moreover, in the chemical pathology lab, we can measure the prostate specific antigen. This prostate specific antigen is secreted by the prostatic cells, and it will dissolve the clot, the semen. When it clots, the prostate specific antigen will dissolve this clot, and it will allow the spermatozoa to flow easily in the fluid medium. So the prostate specific antigen is important, and its elevated levels in the serum indicates the uh, benign prostatic hypertrophy, and elevated levels of prostate specific antigens are also important in making the diagnosis of the carcinoma prostate. Now coming to the treatment of the benign prostatic hypertrophy, what we are going to do is just to relieve the obstruction and allow the urine to pass through the prostatic urethra. For this purpose, we can use 5-alpha reductase inhibitors. As I mentioned, that 5-alpha reductase is the enzymes which convert testosterone into dihydrotestosterone, which is 10 times more potent than testosterone in causing proliferation and growth of the prostate cells. So by inhibiting the activity of these enzymes, we inhibit the conversion of testosterone into dihydrotestosterone, and it may help us in causing shrinkage of the prostate gland. And additionally, we also use the alpha 1 antagonist. We know that the alpha 1 antagonist cause stimulation of the alpha 1 agonists or the alpha 1 receptors will cause smooth muscle contraction. So by using or inhibiting the alpha 1 receptors by using the alpha 1 antagonists, we inhibit the action of the alpha 1 receptors, and this will lead to the relaxation of the bladder neck and also to the relaxation of the smooth muscle in the urethra and prostate, and this will help us in facilitating to urination or to pass urine. If these medicines, if they don't work efficiently, then we will use the transurethral resection of the prostate, in which we introduce a cystoscope, and we remove part or all of the prostate by using the transurethral resection of the prostate through the uh, urethroskop, and this is an option when the medical treatment uh, doesn't efficiently work, and mostly this is a very successful procedure in uh, partial or complete removal of the prostate, and it will facilitate the patient to pass urine. So coming to the summary of the benign prostatic hyperplasia, we know that this is the non-cancerous, benign stromal and endometrial, stromal and stromal and glandular hyperplasia and hypertrophy of the prostate gland. And we know that by the action of the 5-alpha reductase, testosterone is converted into dihydrotestosterone, and which is the major stimulus for the proliferation of the glandular and connective tissue elements of the prostate gland. Most commonly, the benign prostatic hypertrophy, it affects the periurethral or transitional zone of the urethra and form nodules that compress the prostatic urethra. And when we do microscopic examination of the benign prostatic hyperplasia or hypertrophy, we may see the nodules with various proportions of the connective tissue and the glandular tissue. In some conditions, the glandular tissue is undergo hyperplasia and hypertrophy more as compared to the connective tissue, and in some conditions the connective tissue undergo more hypertrophy and more hyperplasia as compared to the glands, and in this situation we will get solid hard nodules. And generally when we see that the presence of solid hard nodules in the posterior periurethral zone, they indicate the carcinoma prostate, while enlargement in the periurethral zone or transitional zone causes benign prostatic hypertrophy. The hyperplastic glands, as we know, that there are two layers. The inner one is the columnar epithelial cell, and the outer layer is the cuboidal epithelial cells, which are flattened which express as the flattened basal cells, and there are papillary projections due to the overgrowth of the prostate glandular layers into the lumen, which also contain the corpora amyliaceae. The clinical symptoms and signs are reported by a little percentage of the people. Not all people and not all aged people have symptoms due to benign prostatic hypertrophy, but those patients who present with symptoms, they have hesitancy, urgency, excessive urination at night time, and the narrow poor urinary stream, and as we know that there is stagnation of urine in the urinary bladder, so it will invite bacteria and will cause recurrent urinary tract infections, and sometimes even acute urinary infection may occur in benign prostatic hyperplasia. Thank you very much.